Coronavirus disease 19, the stages of transmission and methods of prevention. The novel coronavirus named Severe Acute Respiratory Syndrome Coronavirus 2 was identified as the cause of an outbreak of respiratory illness first detected in Wuhan, China in 2019. The illness caused by this virus has been named Coronavirus Disease 2019 or COVID-19. Recently, the Centers for Disease Control and Prevention (CDC) revealed ultrastructural morphology exhibited by coronaviruses when viewed under an electron microscope. The spikes that adorn the outer surface of the virus impart the look of a corona surrounding the virion. The protein particles E, S, and M are also located on the outer surface of the particle and are responsible in the pathogenesis of the disease. So this is a transmission electron microscopic image of an isolate from the first US case of COVID-19. The spherical viral particles, colorized blue, contain cross-section through the viral genome seen as black dots. The transmission of virus is responsible for the pandemic outbreak of COVID-19. So how does this transmission occur? According to the World Health Organization (WHO), there are 4 stages of COVID-19 transmission. The first stage is where there is occurrence of only imported cases. That is, it is seen in locations where all cases have been acquired outside the location of reporting. These are those who have traveled to virus-hit foreign countries and have come back to their home country. Stage 2 is the stage of local transmission, which involves locations where the source of infection is within the reporting location. These are those cases who have come in contact with patients who have had a travel history. Stage 3 is the stage of community transmission, wherein people have been infected with the virus in an area, including some who are not sure how or where they became infected. Community transmission is when a patient not exposed to any infected person or one who has traveled to any of the affected countries tests positive. Large areas get affected when community transmission takes place. And the last stage is the stage of epidemic. There is rapid spread of disease to a large number of people in a given population within a short period of time. This is the last and the worst stage where the disease takes the shape of an epidemic with no clear endpoint. So let's go back and revise the transmission of coronavirus, which we discussed in the previous presentation. So the initial cases were zoonotic transmission, wherein the virus spread from animal, that is, in case of SARS-CoV-2, the animal being bats, and from there it spread to human, and then from human to human through sustained contact. And at present, the main spread from person to person is through respiratory droplets produced when an infected person coughs or sneezes. These respiratory droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Through contact transmission, that is, coming in contact with respiratory secretions of the person, as well as surfaces which have been contaminated by the respiratory droplets. Spread from contact with contaminated surfaces or objects, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. Fecal-oral transmission is also under consideration, as few cases have been reported in relation to that. Whereas aerosol and vertical transmission, that is from mother to baby, has not been evident in most of the cases till date. According to the reports, coughing and sneezing can expel virus-laden droplets onto nearby people and surfaces, where the virus can remain infectious for several hours to days. According to the report, the rapid spread of SARS-CoV-2 could have resulted from spread via fomites, like for example elevator buttons or restroom taps or locks, or virus aerosolization in a confined public space such as restrooms or elevators. It is of crucial importance to estimate the reproductive number or R0 number of the novel virus in the early stage of the disease to assess the severity of the outbreak and make a prediction of the occurrence of new cases. According to a study by Zhang S. et al., the R0 number for SARS-CoV-2 was estimated to be between 2.06 to 2.52, average being 2.28. So what does this mean exactly? The R naught number implies that the transmission can take place from one person to 2.28 different people. So one infected person can infect 2.28 different individuals and so on. So if we plot a graph for this R naught, it will be increasing exponentially. The future daily incidence and probable outbreak size is largely dependent on the change of R naught. Unless strict infection management and control are taken, reports indicate the potential of COVID-19 to cause greater outbreak than the initial cases. In order to curb the infection, we need to interrupt transmission and bring the R naught to less than 1. This will inhibit the spread of the disease person to person, thus decreasing the chances of an epidemic. So how do we halt the spread of the infection? Certain guidelines have been laid down by the government of individual countries as well as the health organization, which can enable us limit the spread of the infection, which are: if you feel sick, stay home, do not go to work, contact your medical provider. If your children are sick, keep them at home, do not send them to school, contact your medical provider. If someone in your household has tested positive for the coronavirus, keep the entire household at home. Do not go to work, do not go to school, contact your medical provider. If you're an older person, stay home and away from other people. If you're a person with a serious underlying health condition that can put you at increased risk, like for example, a condition that impairs your lung or heart function or weakens your immune system, stay home and away from other people. Even if you are young or otherwise healthy, you are at risk and your activities can increase the risk for others. It is critical that you do your part to slow the spread of the coronavirus. Work or engage in schooling from home whenever possible. If you work in a critical infrastructure industry, such as healthcare services and pharmaceutical and food supply, you have a special responsibility to maintain your normal work schedule. You and your employers should follow CDC guidance to protect your health at work. Avoid social gatherings in groups of more than 10 people. Maintain social distancing, that is, maintain at least 1 meter distance between each other. Avoid eating or drinking at bars, restaurants, and food courts. Use drive-through, pickup, or delivery options. Avoid discretionary travel, shopping trips, social visits. Do not visit nursing homes or retirement or long-term care facilities unless you provide critical assistance. Practice good hygiene, such as wash your hands, especially after touching any frequently used item or surface. If your hands are visibly dirty, wash them for at least 30 seconds. If they are not visibly dirty, wash them for 20 seconds, or you can use an alcohol-based hand wash. Avoid touching your face, especially the T-zone on your face, which comprises your eyes, nose, and mouth. Maintain respiratory etiquettes and sneeze or cough into a tissue or the inside of your elbow. After using the tissue, dispose the tissue in a dustbin. Disinfect frequently used items and surfaces as much as possible. So this was about the transmission stages of COVID-19 and the measures for its prevention. I hope you have liked this presentation. Please do like, share, comment, and subscribe to the channel. Thank you.